Well, let's now bring in at this time National President of the National Association of Resident Doctors, Godiya Ishaya. Thank you for joining us on TVC News at 7. Finally, the resident doctors have suspended the strike after 63 whole days. What exactly is the rationale behind this decision?
Well, thank you very much for having me this evening. Well, the decision came against the backdrop of some engagement that we had with the government officials and those officials who were stakeholders in the resolution of this our strike action that was embarked upon on 2nd of August 2021. Following our inauguration as the new executive of the association, we came and interacted with some of these officials, and we discovered that there were a change of posture from where they were before our inauguration. So when we saw the change of posture and some of the commitment that was those commitments that were resolved to be implemented by the government,
yes,
and following the implementation of such commitments, we felt it was a very appropriate time and a very good window for us to call for NEC and discuss with them, and so that they can take appropriate decision.
All right, but Dr. Ishaya,
we held a meeting.
Okay. Okay, I was going to the point that, yes, now the strike has been suspended, but the resident doctors are also threatening that if within 6 weeks their demands are not met, then you're going to resume the strike. Do you consider that the government and other stakeholders who are involved with this are really going to take the resident doctors serious, because you're calling it off and in just 6 weeks again, you're planning to embark on a strike?
Well, actually, we suspended the strike not because everything that we went on the strike demanding that the government be or implement. They didn't actually implement everything. But however, when we look at the change of posture and what they have done so far, we felt that it was the appropriate time to resume and render some services to the Nigerian populace, those who cannot afford to travel abroad for medical tourism or patronize the private hospitals within the country. So we felt we needed to suspend it at this point and continue negotiation and follow things and see how the federal government will continue to implement those agreements that we have entered with them.
All right, Dr. Ishaya. Before now, the government spoke about implementing the no work, no pay policy, which means that for the 63 days, for instance, that the resident doctors were on strike, none of the members is meant to be paid. What is the current posture on that directive by government?
We saw a change of posture as that regard because before now, their posture was that even the medical residency training allowances that were supposed to be paid to our members, their posture was that that medical residency training allowances was also part of remuneration, and as such, they were not going to pay us. But however, when we engaged them recently, they had a change in posture and were willing to negotiate other emolument that was withheld with us, but pending when we call off the strike.
All right.
So and when we consider everything, we decided that we needed to suspend it for 6 weeks to give them the benefit of the doubt and monitor and see how they will continue implementation of what they said they were going to do.
All right, so let's wait to see what the next 6 weeks actually hold for the resident doctors and the nation's health sector in general. Godiya Ishaya is President, National Association of Resident Doctors. Thank you very much for joining us on TVC News at 7.
Thank you very much.